Hello, 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 and welcome to the first official episode of a Frank Hart podcast. So, I am your host, Amber Danielle, and I am excited. I am so excited to officially launch a Frank Hart podcast. So, what does a Frank Hart mean? Where does that come from? Why? What's the story behind a Frank Hart? So, first and foremost, my name is Amber. Frank. Frank means very blunt, direct, open, and that is me. But also, it's a little play on words. Frank, and then Hart. So I am a CHD survivor, as I have a congenital heart disorder. And so my platform is pretty much to be able to talk about all things just life. My journey along this way, because I was diagnosed as an adult. Also, just my heart. This is my heart. This is my passion. To be able to help others. I feel like, in certain situations that happen to us in life, it's all about perspective, right? So you can look at situations that occur to you and you can say, oh, woe is me, or I feel sorry for myself. But along my journey, I realized that, hey, God took me through this for a reason. And so I am here, still here, thank God, to be able to use my voice, to be able to use my experiences, my journeys, trial and errors, things where I've had to advocate for myself, in order to be able to help someone else and help you all. So I hope that you guys join the Frank Hart family. Come with me along this journey, and being able to just come out here and share my story with you guys. And hopefully it will impact you. It will help you along your journey. And we also can have some fun along the way. So again, thank you for your support of a Frank Hart podcast. Let's get this thing going. Chronic pain. Yeah. Let me tell you, I have been through it. Okay. I have been through it. When you talk about, if you are someone that has dealt with chronic pain, you know that it is something that one day is just completely unbearable. Some days you have good days. Some days you have bad days. Some days you're in fetal position in the bed and you just can't move. You become very closely acquainted to your heating pad or your ice pack, whichever one it is for the day. But I started off with having chronic pain, a lot of abdominal pain, also pelvic pain as well. Prior to my cycle, the week of ovulation, so the week before my cycle. And so that's another thing. I'm just going to tell it like it is, right? I'm being frank. Okay. So some stuff, people may think, oh, it's TMI. I'm here to share. I'm simply a vessel. Okay. So with that said, um, debilitating pain. Okay. Debilitating pain, inflammation, through the wazoo. Okay. And so through that, I started having conversations with my medical team and was able to start with ultrasounds. Through the results of the ultrasounds, what I had shifted to doing by default, we have conversations with our physicians at our appointments. And what I have learned along this journey is how important it is to read your medical chart. Technology is right at our fingertips. And we are able to log on to your electronic medical record from a patient perspective. And that is so valuable because of the fact, now it's a catch-22. It's a catch-22 because some stuff you might not be ready to read. Okay. We'll get to that once we get to my cancer journey. But some things, just in reading and researching and being knowledgeable, as a patient is so vital. So, what actually ended up happening, what and now in hindsight ended up being what was called an endo. I had an endo flare. Okay. To where initially it presented as they thought I had a stroke. So if I'm able to insert videos to kind of show you guys, but um, I felt like I was getting ready to pass out. Had to call EMS and things like that. I ended up being okay and checking out okay. Followed up with my PCP in a few days, and so she told me that I needed to go to immediately to the emergency room. So me, being Miss Professional, I had to have a career and things like that. I left the doctor's office. I came home. I packed an overnight bag just in case. Because I just didn't know how long I was going to be there, right? So I just wanted to be prepared, and so forth. And again, this was abrupt. That actually resulted in me being in the emergency room. By the time that the ER provider came in to do their eval, I could not move my left leg. Okay. Literally could not move my left leg. And so when they went to do the assessment and whatnot, I could not lift my left leg. So at that point, they began to panic and thinking that I was having a stroke. Okay. And now fast forward, we'll say, I would say 5 years later, I was able to actually connect the dots and get the answer to that, which we'll get to later on. So from there, I was admitted. It was the week of my birthday. I will never forget. And it was during COVID. So I could not have any visitors in the hospital during that time. But I was on the stroke floor. So I had all types of neuro tests, cardiac exams as well during that time. And they just could not figure out what was wrong with me. Okay. Those that also have been along the endo journey, that should resonate with you, because one thing about endo, they can't figure us out, right? We are a medical mystery. And true fact, it typically takes approximately 7 to 9 years for a woman to officially be diagnosed with endometriosis. Now, after I was discharged from this hospitalization, then I had some follow up. I think it was at that time I had my follow up with my OBGYN for my annual. And so I was just telling her about, this pain that I had been in, this tightness that I was having in my lower abdominal area, and just how painful my cycles had become. Now, mind you, let me also give a history fact that I did have a C-section as far as for the birth of, for my child. Okay, so fast forward to that particular appointment. She then ordered an ultrasound, had the ultrasound. I read the results of the ultrasound, and some of the things stood out to me that sent me down a wormhole of research. That is where the research journey began, because I really wanted to figure out and truly get to the root cause and solve this mystery of what was going on with me. Now, um, through that research, it sent me, and I was looking at different things and so forth. Um, is how I discovered the endometriosis diagnosis. Had a conversation with my mother, and come to find out, she also had the same diagnosis several years ago as well. So what I did was I took that information to my providers, so to my OBGYN, and I also messaged my neurologist, and I said, hey, I think the root cause of my issues are endometriosis. I messaged my neurologist at the time, and he actually confirmed and said, you may be onto something. I would agree, with that. And so I took the same to my OBGYN, and I explained the same thing to her, that I think that I'm having symptoms of what could be, possible endometriosis. And so she, in fact, actually agreed. So I say that to say that, again, it is so important that you understand that your medical team and yourself as the patient, you're a partner, you're partners. Okay. And so it is okay to do research, credible research, and be respectful when you're going to your providers. This isn't saying, well, Google said, or what is it, MedMD, all these different things. Go with credible research. Okay. So where do we go from here? So at that time, that my particular provider had prescribed me a medication that had just been released not too long before that was specific to endometriosis, and it was called Oralissa. And so I had a short bout with Oralissa because I just could not withstand the side effects that it caused. Okay. And then also the recommendation at the time was to try Oralissa for 6 months, and then we would consider possible surgery. Because one of the things that I identified through the research of endometriosis is that endometriosis can only be diagnosed officially through a procedure called a laparoscopy. Okay. I was itching to get on the table. Okay. Cut me up. Let's figure out what is going on. I'm fine. Put me on the table. Put me on the table. Well, my physician at the time respectfully was being cautious. As I said, this still was during the pandemic. So oftentimes when it came to certain procedures, as far as the OR, I believe at the time, and don't quote me, I may be wrong, it was based upon the risk level, as far as what the condition was of the, that needed the surgery and so forth. So something told me to get a second opinion. Now, hear me from my heart. I love my OBGYN, and I was loyal to my OBGYN, birthed my child and everything, and still love her to this day. But something told me to get a second opinion. I had a colleague who also experienced endometriosis. And so she and I would have conversations. And I tell you, it is a blessing to be able to talk to someone and speak with someone that can truly empathize with what you're going through. Okay. And so I got the name of her OBGYN, and I was able to get a referral. Luckily at that time, I was able to get in, I would say within a month or two, in order to see her. And so I came in, gave her the story, so pretty much gave her the whole spiel that I just told you guys, right? Gave her the whole spiel, and I will never forget her reaction. And I told her, I said, I truly think that I have endometriosis. And I remember her response was, heck yeah. And I said, you know what? This is my person. This is my person. And so the lesson in that is that, it is okay to be loyal to, our medical providers and things like that. But sometimes it's okay. And it's not, don't feel like, you're being offensive by getting a second opinion. Remember, you only get one you. We only get one body. And so we have to do the best, what's in the best interest for us, right? Okay, so we are at the new OBGYN, and I explained everything and pretty much asked, like, hey, I see that the official way to diagnose endometriosis is through laparoscopy, and do you feel that I would be a candidate for that? And so she agreed, and